So we're here taking a further look at some research that I am looking at, that I'm trying to understand, and then trying to identify possible clinical applications. Now in this case, what I'm looking at is some concepts from motor learning. So it's not absolutely clinical applications, however it leads to clinical applications. As far as motor learning is concerned, we're talking about the initial learning of a motor skill. So in manual therapeutics, whether it's osteopathy or any other form, we have to learn how to move our bodies in a goal-directed fashion. So we have a goal to change the range of motion or change the functional range of motion of a given part. And so what ends up happening is we have these two phenomena: motor observation, and motor observation is just watching somebody perform a motor skill. Motor imagery is essentially the cognitive process whereby motor action is internally stimulated without overt action. So motor imagery essentially looks like this. So I would have been going through some form of motion in my mind, some form of motor skill in my mind, with no overt action. So it's very uneventful on the outside because I'm thinking about something, however nothing externally is occurring. So we can take a look at this in a few different ways, but essentially what I'll talk about is, for a manual practitioner attempting to learn a new skill, usually what's going to happen is they're going to receive some form of demonstration, whether it's from someone in front of them in an educational setting, or from a video, or from reading a description and seeing pictures in a book. These are all possible avenues. So one that I have personally had the opportunity to engage in and teach a fair amount is something that can be called a leg rotation. Other people may call it different things. So I think I've seen people call this hip scrubbing. I may be incorrect in that. Either way, there's a skill. All right, so the demonstration would end up looking like something like this. All right, so you give people cues. Nice straight arm, lean, lift up, then you turn and face towards the patient. You bend their knee, so you're protecting their knee. You set their foot down. You walk up the table. You push their leg across so that you can get your hand underneath their lumbar column or underneath wherever you're attempting to palpate. Right? The whole push across, the idea of the push across is to expose areas of the back so that your hand can go there. Bring them back, you walk down, you hold on, so essentially, I've heard people call this shouldering the patient's leg. Essentially what you do is you get broad contact, so we've talked about contact as control and control as safety. Right? So, and then you wrap and you walk up the table. Now I'm close to what I'm working with, so we look at some of our concepts of patient positioning, although in this case the table does make stable patients. In supine, we're talking about the idea that less stable means I need to make the patient more stable, which isn't absolutely the case here, but the space between us is unstable. So I'm minimizing negative space. I don't want to be down here if I'm trying to work in the lumbar column. I want to be close to the lumbar column and close to the table. Right? And then we teach people, you can talk about moving from the body. So you see that I'm not moving just with my arm here, because that could be very tiring for me. I'm just moving my entire body as a single unit, essentially, although there may be some points in this kinetic chain that are not absolutely moving at the same time. There may be some breakdowns, and that's fine. But then what we talk about is grabbing the patient's ankle, pushing across so that your hand can come out, supporting their knee, and coming down. So a very cursory overview of a skill. The way that I learned it, it was termed leg rotation. Other people may hear that as different things. But what you have there is an opportunity, as somebody watching, for motor observation. So if I choose to break this down into varying steps, I instruct you in the steps, you observe them, and then I give you the opportunity to practice them. Now, while under motor observation or performing motor observation, effective motor observation is shown to improve motor learning. So you want to view the demonstration you're receiving as accurately as possible or as effectively as possible. So make sure you're in the areas that you need to be in to understand what's going on. And that's going to be unique to each individual. There may be an optimum strategy that I've never seen, but try to figure out the best way for yourself to watch a demonstration. Subsequent to that, so as you're going through that motor observation, you have the opportunity to create motor imagery. So again, the internal stimulation, the cognitive process of the internal stimulation of motor action without any motor action without any overt movement. And I may have misquoted that slightly as compared to what I did before, and that's all right. But what you can do before you even go and practice the skill is you can have a pattern that follows essentially the dance steps of what was taught, okay? Whatever that may be. So you can perform these movements without a patient prior to ever executing them. You can do all of that by utilizing motor observation, motor imagery, and then essentially rehearsed practice without a willing participant. When you go back to the opportunity to have a willing participant, you can then walk through all of the dance steps that we talked about. Okay? When you have an opportunity to practice, you have essentially a rehearsed pattern. And this is for learning motor skills. This isn't absolutely perfect for learning treatment, but it is very useful for learning motor skills. Now, what happens when you've gone ahead, you've received your demonstration, you've used motor observation, you've used motor imagery, you've had an opportunity to practice with a willing participant, but now, say the period of time when you have a willing participant is done, and you need to continue practicing to further cement that motor skill, at least as a starting point. Well, when you don't have a willing participant, what do you do? Right? Well, as I talked about, you have those rehearsed dance steps. And you can do these things at any point. Now, what I'm doing now is not necessarily strict motor imagery. It's the utilization of motor imagery and a rehearsed pattern kind of in combination. So you're actually putting them together in an attempt to improve your learning. So not everybody, when they're learning a motor skill, is going to have the opportunity to have the full complement of things to put all the pieces together. So when you don't have that, so such as when you have an empty table in manual therapeutics and you don't have a willing participant, you can utilize things that you've seen, things that you've practiced to create motor imagery, which again looks very uneventful. Or you can utilize that motor imagery and actually create the physical movements so that those physical movements occur and you have some form of neural patterning that may not be ideal when a patient is present, but at least you've had the opportunity to rehearse, to practice, so that you're ingraining those patterns a little bit more deeply. When a patient or a willing participant is present, you can further refine that skill. But the idea is we want to use those concepts of motor observation to motor imagery to actual practice, and then in an appropriate fashion to use motor imagery. And the appropriate fashion to use motor imagery as well as rehearsed practice is when there isn't a willing participant, because a large portion of your time as a student or even as a practitioner trying to learn a new skill, you won't necessarily want to be experimenting per se with patients or working on people feeling like you don't know what to do. So as an adjunct to motor learning, you can use motor imagery. Now, understanding that motor imagery can very usefully improve motor learning, it's not the same as actually physically performing the act, whatever that act may be, or the skill. So in the case of a leg rotation, the number one thing is to practice leg rotation as consistently as you can, or any other motor skill. Second to that, when you don't have a willing participant, utilize your motor imagery.